The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to HDSA's Caregivers Corner webinar series. This is Jane Kogan, and I am HDSA's Education and Advocacy Manager. Today, we're pleased to welcome Dr. Janet Williams, who will be presenting on how to talk about HD with children and youth. In the last several years, Janet was instrumental in creating HDSA's resources on the topic, which you will hear about later this presentation. She co-chaired the Talking About HD to Youth resource group and brought the voice of a nurse scientist and clinician to a 27-page pamphlet and later a 111-page monograph. Janet is a professor of nursing and chair of the Behavioral and Social Science IRB at the University of Iowa. She has over 135 publications, as well as 23 intramural and extramural grants on genomic, behavioral, social nursing topics. She served on 12 standing and special review study sections at CDC, NHGRI, and NINR, as well as the NINR Advisory Council. Janet's research includes examination of international teen experiences, family management, genetic discrimination, as well as function of individuals with pre-manifest HD, as well as communication among families and healthcare providers regarding genetic testing results. Before I invite Janet to begin, I'm going to take a moment to review how you can ask a question, as well as how you can access the webinar after broadcast. We're going to be answering questions after Janet's formal presentation. However, you can send a question at any time. To send a question, you go to the control panel that you see on the right-hand side of your screen, this right here. Type in your question and hit send. This webinar will also be available for broadcast on the HDSA National website. To access this presentation, as well as all other presentations, you can go to hdsa.org/ccorner. You can also find HDSA's Caregivers Corner in the right sidebar of the HD Care section of Living with HD. Additionally, you can find HDSA's Lunch and Learn webinars at hdsa.org/LL. I'd also like to tell you about our future webinars that will take place in July. On July 9th, we're going to have an attorney who's going to be presenting on HD and Medicare. And then on July 22nd, we're going to have somebody presenting on resources for the caregiver journey. And now I'm so excited to turn it over to Janet.
Thank you, Jane, and thank you for the opportunity to speak with all of you today about having conversations with children about Huntington disease. I'm going to just pause for a moment to make sure I understand how to advance my slides in this webinar. And so I'm going to ask Jane if what I have on the screen is clear.
So Janet, you want to accept being a presenter.
Okay.
You see a little box on your screen that says accept presenter, and then everybody else will be able to see your screen.
All right. Okay, it says I can close the confidential window. Is that what I should do?
You press OK.
I don't see that choice. I see show my screen.
Yes, press the show your screen.
Oh, good. Okay.
There you go.
All
now
right. We see the screen. Thank you. Thank you. So this is my first time working with this equipment, and I do appreciate your patience as we get started. So as Jane said, I've talked with children, I've talked with parents about talking in the family about Huntington disease. And so what I've presented today is a summary of what kids have told us. And this mainly came from the research that I've done with work I've
Janet, so
yes.
Sorry to interrupt you. Can you maximize your slides by going to begin slideshow? Like that, yes.
Yes, I can. Got better?
Perfect.
All right.
Yes, perfect.
So as I was saying, I've talked with teenagers and young adults whose parents or family members have Huntington disease. And it's done that over several years in the United States and Canada. And it's been through my research and also through attending the Huntington Disease Society meetings in both countries. I've also talked with parents and listened to the kinds of things they say they would like help with. And that's really the basis of the information that I've put together for the webinar today. What I plan to talk about is, first of all, some general principles about having a conversation with children with who are in families where there is a family member with Huntington disease. Then I will go on to talk about some examples, some things that are good examples, things that might be useful to you as you're thinking about how to have these conversations. I'll also bring up some examples that are not very positive or constructive for kids or their parents. And then we will come to the end. I'll talk about some resources, and then there will be time to address the questions you have. It's a little ironic that I'm talking with you about having a conversation with children at risk or in families with Huntington disease, but for the majority of the time I'm actually just talking to you because I won't be able to hear your questions or see your responses until closer to the end of the webinar. So I'll go ahead and proceed with the content now. This is the major outline for what I hope to go over with you today. First of all, why would it be important to have these conversations? Next of all, who could be involved in the conversations? How would you go about having them? Where is the ideal place to have them, and when? And then the majority of our time will be spent on what. What is the best way to think about the content and the information that's important to share? Sometimes I'll talk about the children as kids, which is kind of a shorthand, but I'm thinking about those who are school age, those who are teenagers, and those who are young adults. And the types of content, for example, will vary according to the age at which the children are. And it will also somewhat depend on your role in the family or your relationship to the family, if you are the person in the conversation with a kid in the family. So we've already talked about how I know about this, and this is who I am. And now we'll go a little further into why I have the conversations. I know that in some families, it's not the family's habit to have a conversation about HD. And I think we're all aware of situations where the presence of HD has been hidden or not acknowledged in families. I'm going to take the position that it's very important to have this conversation because, first of all, although the facts about HD are difficult, they are not pleasant to talk about. They're difficult and scary for family members. It is, in most cases, much better to have facts so that you can deal with the facts and think about what you can do rather than relying only on imagination, which may, in fact, be much worse than having factual information. Secondly, if you're having the conversation with a kid in the family about Huntington disease, the information is somewhat under your control. You have control over what kind of information you're prepared to share with your child, what you think is appropriate for your child's age and the circumstances going on in your family at this time. And you can also then, secondly, have an opportunity to judge the impact of this information on your child. You're not completely in control, of course. There are at least two of you in the conversation, but it gives you an opportunity to make sure that the information that you're exchanging with your teenager, your young adult, or your school-age child is as accurate as you can make it, and you can pause and stop and deal with the emotions depending on your child's reaction as you talk about the information. And it's also important to keep in mind that the point of the conversation, at least for what we're talking about today, is to do what you can to further benefit the well-being and the health of your child. The focus for many of my comments today is on the child. I know there are at least two of you in the conversation, and we will talk about the adult in the conversation towards the end of this webinar. But at this time, we're mostly focusing on the child. And the reason to have the conversation is so that you can equip your child with information that's accurate, is presented in a way that is in context of your family, and you are monitoring your child's well-being as you go along through this. And finally, by sharing the information, hard as it may be, it brings your child, teen, or young adult into the process of coping with HD. So things are going on in the family because one or more members has Huntington's disease, and by talking about it together, you haven't isolated the child. You're all coping with the changes, including the person who has HD. And by including the child in this conversation, they can contribute to the coping. You can give each other support as you go along. The next thing to consider is that the conversations probably won't and shouldn't happen just once. It's not the big talk where you think I have a lot of information to tell my child and I better just get over it and lay it all out. But it's, I think, better to think about it as the start of many conversations. And one way to think about that is to tackle what your child wants to know now. As you open the conversation with your child, teen or young adult, about Huntington's disease, pay close attention to what they're interested in, and we'll talk a little bit more about the back and forth part of the conversation. But keep in mind that there are some topics that may not come up in the first or second or fifth or 10th conversation. They will be important at a later time, but they may not be the most important things to discuss. So you tackle what needs to be talked about now, and then be aware that some of these others may come up later. As you have the conversation, there may be questions that you can't answer or information you're not very familiar with, but you can offer to work with your child to find credible resources. I'll talk about the internet a lot because that comes up a lot as we talk about conversations and what kids do. And here's a place also to mention that finding credible resources is very important. I did a little search of the internet as I prepared this talk, and I was very disappointed in some of the information that I saw. And I think it would be upsetting and it would be confusing, especially to younger children, if they inadvertently get into some of those sites where they can't fully understand the purpose of the site and they can't really make sense of the information and determine what is believable and truthful and what perhaps isn't so truthful. One of the resources that I'll mention several times is the Huntington Disease Association of America. This is a place where you can go to find out where the credible resources are. And as we talk about the people you can consult, that's also an opportunity always to say to people from the Huntington's Disease Society, I've run across something, I'm not sure if I can believe it or not, because that's where you can go sometimes to get the most immediate and honest help. And then third, as you have these conversations, this is an emotional time, and it's okay to acknowledge your emotions. You may not be able to get through all the topics that you wanted to talk about. You may need to take a break. You may need to say that to your child, I'd like to talk with you some more, but I really need to take a pause here, and maybe we can pick this up later. Keep in mind, it's not a marathon. It isn't necessary to get everything spoken and discussed in one sitting. Probably is unrealistic to even imagine you could do that. If you have not had any talks at all, at least we're talking now about still opening the door so that you can have future conversations. So now we'll go into a little bit more of the nuts and bolts, kind of laid out the ground rules here. First of all, who would be in the conversation? And I've already explained I'm thinking about children all the way from school age or even younger through young adult years. It might be both parents who are in the conversation, the person with HD and the person who doesn't have HD. It might be the person who does not have HD. Or it might be one of the parents or perhaps a trusted adult. And throughout the presentation, you'll see sometimes there are quotes in blue, italics format, and there are quotes in kind of a reddish-brown italics format. Whenever you see blue, that is a quote provided to me by a child, a teen, or young adult. Whenever you see something in red, that's a quote provided to me or written in the voice of the parent. So I won't read them all to you, but we'll just go through this one on this first page. Who should be in the conversation? One girl said to me, my best friend's mom is a nurse, and she explained it to me. This was in the context of having her mother tell her about HD in the family member, and then this girl had questions that her mom couldn't answer, but the nurse was a trusted family friend, and the nurse could provide some information that the mom could not. Other trusted adults might be counselors, social workers, and as I said, people involved with Huntington disease care or the Huntington Disease Society. A parent said a counselor was priceless. The children could talk with her in a way that was different than me. This is a good example of especially the kind of help that may be very important to teens, because as teens go through the teenage years, they're starting to develop their definition of who they are, who's important to them, whose opinions they really trust. Sometimes parents are in that group, sometimes not so much. That's a normal part of growing up. And especially for teens, trusted, knowledgeable adults who understand how to intervene in crisis or with family illnesses can be a wonderful partner to work along with the parent. The third quote is from a parent who did it alone by herself, and she waited until her son was an adult. She said, "I decided to tell him before he got married." This might be the best way she could have gone about it in her family. It did mean that he didn't get the information until he was ready to make a major life transition. And it illustrates that that might be effective, and it might have been helpful, but perhaps starting earlier could have maybe laid the groundwork for this very important information. How to bring it up? Well, this is a topic that is not easy to talk about in some respects. I've already acknowledged that. And so here's an example of what a parent might say. And this example has several components to it. First, it acknowledges your emotions. Yes, this is a hard topic. In fact, I'm going to name my emotion. It makes me feel sad. It's a sad topic for me. But now you're going to focus on what's the point of this conversation. You have some facts you're going to talk about, and it's about the child's parent. I'll just comment here and probably bring it up again. Children are very, very excellent observers. Sometimes they're going to be asking you questions when they see things going on at home. Sometimes they're going to keep it all inside. You don't know what kinds of things they're wondering about. But by starting your conversation in a way such as this example, it acknowledges your feelings. It indicates this is important. This time I want us to both give our attention to this topic, and this is what we're going to talk about. As I said, one mom did it alone, and fortunately now we have a lot of resources that we hope will be helpful to you. The first is the telephone number for the HDSA. Talked about that already. It is, as you know, an organization that is comprised of skilled and experienced healthcare providers who are knowledgeable about HD, and families and people like yourselves. So this is an excellent place to start if you have a problem or a question and you don't know how to solve it. If you have the opportunity to be near a center of excellence, the staff there are also very important resources to you. Physicians, psychologists, nurses, social workers, counselors, patient and parent advocates all are experienced and have some insights into you and your family and what approaches might be a good fit for you. Jane mentioned two resources that recently have been published by the HDSA, and the first one is the brochure that's in the upper right-hand corner, and that one helps you start the idea of talking with your kids, and it is arranged to give you some ideas about how to start based on the age of your child. And it also gives some hints on what would be helpful ways to speak and what might kind of stop the conversation. So there are good examples in that brochure. The monograph is the blue, more of a magazine type of resource that's on the lower right-hand corner. This one is arranged almost like a catalog. So as we put this together, we identified what are the topics that are going to be challenging for kids and their families to talk about. And so the book is arranged according to those topics, and you can go to the index and find the one that might be most pertinent to you at this time. For example, talking about dating or talking with the school system. Those are topics that would be perhaps useful to you, especially if your child is at that point in their life. So we have some ideas for starters, and I'll just give you a couple of ideas that we developed for kids who might start the conversation with their parents. This might happen before you're even ready for the conversation to take off. But we've said to kids, you might bring up a topic before your parents are ready. And certainly this is true for parents. You might bring up the topic before your kids are ready. So just be aware that you may or may not have an idea in mind, have certain points in mind you want to cover, and that this topic may just start off without you even having a chance to have that preparation, or your child. And secondly, the kids may have in mind what they want to tell you. Regardless of what you want to say to them, there may be some issues that kids need to let you know about. That's an important illustration that this is a two-way conversation. And as we talk, we'll talk about that a little more as we go along. If you go away with nothing else, I hope these ground rules will be helpful to you. These are the ground rules that I've kept in mind as I put this presentation together, and I think they're important whenever families are talking about challenging topics. First of all, it's a conversation, so both partners get to talk. So if it's you and your child, or maybe the two of you, two parents and your child, everybody should have a chance to talk. Regardless of what you hear, stay calm. Tell yourself, it's okay. I might hear some things I'm uncomfortable with. I'm going to just sit it out. I want to hear what my child has to say. Be honest in your reply. You may feel angry at some of the things your child says. You may not know the answer to some of the questions, but that's better than trying to cover up. Show respect. You've asked your child to listen, and you are now, the fifth ground rule, you are promising to listen to them. So the blue text is what a girl told us about her attempts to talk with her mom. So she's a teenager. She's kind of pissed at her mom. She said, "You don't really get it. You don't know what it's like to be me." If any of you have had teenagers, you'll know that's not too uncommon, and it was very difficult for the mom, to hear it in this context. Well, how could this mom respond? In the red text, here's some things that might be helpful in responding to this teenager. I put those little dots in there because those are all opportunities to listen. Sometimes the most important part of a conversation and communication is when people aren't talking or just one person is talking. So in this response, the mom says, "You're right." She's honest. "No, I'm not you. Can't fully understand that. But I want to hear what you're thinking." Okay, she's honest. "I care about you." She's showing respect to her daughter. And then she says, "How can I help?" That opens the door so that the conversation can keep going. Where might this conversation happen? Well, if you've had opportunities to listen to your kids, you'll find out, or you already know, that it happens when you least expect it. You're in the car, you're trying to get to the soccer game, you're late, you're busy, and there's a crisis going on, and your child asks a question that you're not expecting. So you might find that it happens when you're not ready. If at all possible, talk with your child about arranging for a private time and space where there wouldn't be distractions. Cell phones are turned off, homework's done. You have a chance to sit down and talk together without distractions. You want to be able to do the best you can, and you want your child to be as comfortable as they can be. When might you have it? It's ideal in many families if this becomes an ordinary part of your conversation. And here's an example of what a parent might say if a child has noticed that mom is having trouble walking or remembering. It's a fairly factual statement. It just gives the child the facts. There's a disease that's causing these problems. Certainly, if it hasn't become part of ordinary conversation, it's important to talk about it when changes are apparent in the person with Huntington disease. This example acknowledges, yes, I see changes too, and we're doing something about it, and we'll let you know. Now, as you think about that, you may want to select one of the most important things for your child to know as the information about Huntington disease becomes clearer and the evaluations continue. That doesn't mean that you're going to lay out everything all the time in every session, but it acknowledges the child, brings them into the conversation, and again, applies those ground rules I mentioned. Here are two examples where it's not ideal for a child to first learn about Huntington's disease. First example is a child who noticed the mail, had not heard the term Huntington's, and didn't know what it meant. The second example is a young girl, who read about Huntington's disease in her biology class. And she didn't know what it was, but she thought it was something that she'd heard about in her family, but no one had talked about it. So she did her own research, going to the school library, looking it up on the internet. And as she told us about this, she told us about how difficult it was for her to get the information by herself off the internet screen when she really didn't have any way to make sense of it. So I would urge you, if your children are moving through the science curriculum, even in middle school, junior high, be sure that you're aware of what they have available to them in their classes, and to anticipate talking with your children before the information first appears outside of the opportunity that you have at home to talk about it. Now, as I said, most of the topics will focus on what. So I'm just going to pause for a minute, and we're going to turn now to what would go into the conversation. It depends on the age of the kid in your family. I already mentioned that. We'll talk about the facts. There are some facts, and it can be very simple facts or become more extensive as your child is older. Regardless of the age of your child, the facts should include what is it and what will happen to the parent or the sibling who has Huntington's disease, if it's juvenile Huntington's disease. These are the kinds of things that kids want to know, will think about, they'll wonder about, even if they don't ask you outright. They also will wonder what will happen to them, their children in the family. They'll want to know what happens to them when mom or dad the disease becomes worse in their parent. And that might be, will they have to change schools? Will they have to move? They may also want to know, at some point, will they get sick? And they will want to know, did they cause it? This is sometimes part of what children imagine, and this is an important place to bring in the facts. It's not something that we caused, it's something that's part of mom or dad. So what is it, and what does it have to do with me, the child? Here's an example, two examples of parents offering very brief facts about Huntington's disease. The first one just talks about the fact it affects several parts of a person's function: muscles, memory, thinking skills. I think the second part is also very important, and that is to talk about what is Huntington's like in your family. And there are two major points here. First is, what is it like, what are the symptoms like in the persons in your family who have Huntington's disease? Not everybody starts out identically. The severity of the symptoms will be different in different people, although it follows pretty much a similar trajectory. Not everyone with Huntington's is identical to everyone else. So it can help make sense of the information that your child may be getting from other places, to personalize it about, this is what it's like for your brother or sister, mom or dad, grandparent. And the second part is something that is sometimes very troubling to kids, and that is to add this part in your explanation. This is how we deal with it in our family. In some families, people don't talk about it. In some families, people are not nice to each other when they realize that Huntington's in the family. And it's important to help your child understand that part too. There are behaviors probably in every family that we may or may not like about our relatives. And although that may be very painful to talk about, it can help your child understand it, and how are we going to react to it, so that the child is not distressed beyond what you can help them with. The other part of this is how can we work together? Is this a family where we all want to contribute? Is this a family where each person can contribute somewhat, but not all the same? So again, this brings the child into the coping and the family plan. What's working best for you? It also means you turn the conversation back to your child. You have some information to share, but this is an important time to pause and to say, well, what do you think is happening? What have you seen? And this is an example from a young man. He was talking about his grandmother, and he said, I don't know if he figured it out on his own or if someone told him, but he was doing a very good explanation of obsessive compulsive kinds of thoughts and actions. And he wasn't bothered by it. He knew what to do about it. He had an explanation for it. By asking what you wonder about, this allows you to hear what the child is thinking, and it's not uncommon for kids to say, I thought I was the one who made Dad mad. I knew I didn't break the computer, but he thought I did and was really mad at me. So this is an opportunity to back up a little bit and talk about the effect of the Huntington disease on Dad and his emotions, and then perhaps talk about a plan how to make it less likely that there'll be a crisis centered around the computer. At some point, this conversation is going to turn to what causes it, and could your child have it? And I think for parents, sometimes this is one of the very difficult things to talk about. It's important to be factual. If you didn't cause it, it's caused by a mutation in a gene, and of course it depends on your child's age if they understand those terms. And you also then here have the opportunity to use these resources that I mentioned. There is information that you can find about learning when you're 18 or older, if you yourself have inherited the mutation for Huntington's. You might have and you might not have. We don't know that now, especially if you're talking to a child who's under 18 or a child who hasn't had testing. And here it's also important to say, I may not be able to answer all your questions, but there are people who can. And it's also an opportunity, if you're comfortable with this, saying, I could tell you what I think about these decisions, but I don't know if you'd like to know that now. So you're giving some of the control in the conversation to your child. They may be very interested in knowing what you think in the advice that you might give them. That doesn't mean they will necessarily take your advice, but it is an opportunity to keep that conversation going. And it acknowledges that ultimately that decision about testing rests with your child when they turn 18. And then including in all this what is our plan, turning the attention, in this case, to the parent with Huntington disease. This comes from our conversations with teenagers, and they told us various ways they had devised to try to help. In the first example, this was a teenager who understood the rules. He understood how to help his mom be safe. But he was having, and he wasn't having any trouble with the rules. He was having trouble with the family who didn't want to abide by the rules. His issue, his conflict was with the family. He was trying to help his mom and protect her and keep her safe, but things weren't going so well when the relatives came over. If you're aware of this, you can help, and so you can come up with a family plan where everybody's working together, not conflicting with each other. The second two examples, I think, were from kids who really didn't necessarily talk with their parents about having a plan. They just quietly tried to do everything they could to protect their parent, make up for the problems the parent was having, and do it in a way that wasn't going to cause any conflict at home. The thing that you can do as a parent is to acknowledge that, to say, I noticed that, it's really helpful. You don't have to do it all by yourself. Again, it moves you into talking together about a coping plan that is useful and helpful for everybody. One of the things we did, in addition to talking directly with teens and youth, was to conduct a survey. We did a United States survey where all of these ideas that teens were telling us as we talked with them in focus groups went into a paper and pencil survey, and we had 44 responses. Out of that survey, we learned what helped them the most, and this is what, from their viewpoint, they found out information on their own. So by this time, not only were they seeking information from their family, they were taking the responsibility and going on their own, doing reports and doing their own research. This example is an example where things didn't turn out so well for the teenager, so I want to bring it up. She learned about HD at home. She recognized that in biology, HD was one of the examples in a biology class, and everyone was doing a class project, and so she decided to do her class project on Huntington disease. As you might already have figured out, this was not acceptable in her family because not everyone in the family wanted the information shared in the community. This is another reason why it's important to have conversations early as reasonable for your family, factual, so that you can help your child understand what is appropriate as far as how you're going to manage talking about HD. And in this case, she learned a lot about HD. It helped her with that, but there was a consequence that was not anticipated. The main thing that helped these kids, as they told us, is that they valued the parent with HD. I said this was a survey responded to by teenagers and young adults. They wanted the time with their parent with HD. They wanted to be able to talk with their parent with HD, and they valued the relationship that they had with their parent. One person said, I just want to be with my mom before something really bad happens. This was a teen whose mom was beginning to have difficulty speaking. And this teen wanted to be able to talk with mom, share the experiences that were going on in school, have the mom provide the teen with some advice or laugh at the funny things that happen, share the disappointments, just the day-to-day things that parents and teens can do for each other. Teens also found their own ways to cope, or school-age children, and this was very typical of what kids would normally do. So, for example, in the upper right-hand corner, we have some younger children playing soccer. Children tend to be doing things with their peers. They tend to do things that are fun, and often it is sports that the older kids talked about in the survey. They want to do things that are fun. They want to spend time with their friends, and sometimes that means they are not at home. Now that can be all positive, and there are also a couple of not so constructive things about this. If teens or young adults or younger children are keeping busy away from home, it may be that they just can't be at home. They're very uncomfortable being at home. And as a parent, it's important for you to know that so that you can help them find appropriate things to do. If it's too stressful at home, figure out what an alternative is so the kids aren't left to their own devices. The same thing with doing things that are fun. It's fun to play soccer. It's fun to do art and to become good at a hobby or skill like dance. There are things that kids can try that are fun but not constructive or healthy. And then, just as you would in all circumstances, keep your eye on that as well. And spending time with friends, same principle, knowing who the friends are and what they're doing. As I said, the priority for kids is being a kid, growing up, wanting to be with friends, and wanting to be valued in the family. Here are some examples of what they told us where things weren't going so well. So the teens were telling us there was some conflict. They wanted to be helpful, they wanted to be a part of the family, but they wanted to be with their friends, but things weren't working out too well for them. Any of these things are normal things. They can come up with teens and parents. As you have conversations, especially with teens, it's worth keeping these in mind so that you can ask, are you doing okay with this? Is there something we can do? You might notice I'm really busy right now. I know I don't have much time for you. Any of these conversation starters can help you open the door with your teen. The conversation stoppers might be, well, you're just going to have to do it the way I say. You shouldn't talk like that. I'm too tired. Leave me alone. As you can imagine, there are lots of things that just might come out of your mouth because you're tired or you're stressed. And as you think about these conversations, do give some attention to what you can say that will leave the door open and go back to those principles I talked about as respect and honesty, so that you can be always aiming towards coming up with something that's positive for your child. What they did that didn't help, we really only found one thing in the survey, and that was primarily that they hold their emotions in. And that was not one thing, but that was the most prominent thing across all of the people who entered the survey. So all of these ideas that we're talking about in this hour are really ways to help the teens not leave their emotions in, to keep the door open so that if they can talk with you, they can tell you what they're feeling. If they can't tell you all of that, you can help them find someone safe they can talk with. Here are some alternatives. Well, they didn't know who they could talk to, but some, such as the girl whose friend's mother was a nurse, or the parent who found a counselor, some did find a trusted adult. The girl who found out about Huntington's disease alone in the school library, the school counselor came along and found her there, and he became a trusted adult for her to work through this time of learning about Huntington's disease. And there are social media sites. These are not always good sites, but if you go through the Huntington Disease Society of America, they can help you find the ones that are properly monitored and have accurate information. So moving along, we'll move along a little more quickly here so that we have time for questions. In your plan, be sure to consider who you want the children to think about telling. What do I say to friends or others? This is kind of a hard topic to start with, but we're more and more aware that children can be bullied when people in their family are different. And we've heard that from kids whose family members have Huntington's disease. This is a website I'm putting up from the American Academy of Pediatrics that is excellent. Finding out what is bullying, it's not okay, what can you do so that you don't find your child in a situation where they can't handle if it starts to happen to them. Talk with your child about what you don't need to say. And this goes back to the girl who did the poster for a school project. Talk with them about what's private information and what is not private information in the family. It doesn't mean that Huntington's disease is shameful. It just means that there may be certain parts of it that you're not ready to have shared outside the family. It's much better to talk about it with your child so that the child understands the rules that you're all comfortable with. Who might you tell? These are examples from parents. These examples came from the monograph that I pointed out to you earlier, the blue book. Please help me know, they said to the school counselor. The school needed to know, and they thought the counselor or the school principal, in this case I think it was the counselor, needed to know, but to keep it private, which they should do. Her daughter already knew which friends would be safe and which friends really wouldn't tell this to. So she talked with her daughter and they worked out a plan together. When serious dating comes along, there's a risk that the boyfriend or girlfriend won't stick around, but they might. So here are some examples of what parents said to their kids as they were starting to anticipate this situation. Again, it's part of a plan. Social media, I've already mentioned. Two things to keep in mind before your child starts putting anything on social media is you can't control the information that goes out beyond what your child posts. They may post it as private, but that doesn't mean it will always stay private. And you have no assurance of the accuracy of information that your child sees on the internet. You know that people sometimes present themselves as something they're not, and as I said earlier, I did just a quick little search on my own and saw things that I thought were clearly not accurate and wouldn't be appropriate for younger children. So what is your plan for decisions? Some decisions, and this came up especially for older teens and young adults. As you're talking with them, they're thinking about going away from home. So this is a good time to say you've been really helpful here, but I know you're thinking about leaving home, and I want to make sure you understand that we can do something different that will help your mom or dad or your sibling when you're no longer here. And the second one goes back to the decisions about testing, the decisions about getting married, having children, are hard decisions to make, and people's ideas change. They don't have to stick with their original decision, but these are some things that kids told us that they were pondering. What about the future? Here are examples of what parents might say, again, to help children as they think about leaving home so that you open the door for these topics. And I'm going to spend just a moment on long-term decisions. This is one of the hardest things that can be discussed in any family. It's hard to talk about the diagnosis, and it's hard to talk about end of life. I bring it up because young adults sometimes end up being the people who are expected by the healthcare system to carry out the wishes of their parent. So it's, I think, better if when you have an opportunity in your family to think about end-of-life wishes for the person with HD, that your older children are not excluded from those, from awareness of those conversations. The Center for Excellence, the social workers, people in the support groups, your primary care providers, all can help you with this. I wouldn't advise anyone to go through this part alone, although that may be how you choose to do it. There are people who can help you. And it's important, I think, in many ways, but certainly looking at this quote, the people with Huntington disease may have wishes they want you to know, but they want you to know it while they can express those feelings and opinions. And I think it helps everyone if you have that chance to have that information. Hopefully it won't be needed for a long time, but at least it's there at that time when the time comes up. So now I promised we'd turn to you, the adult in the conversation. There are support groups that can be very helpful to you. The Centers of Excellence, the HDSA, the state chapters, can all help connect you with people like yourselves. You may have a trusted friend. Sometimes adults say, I really have this close friend, and her husband doesn't have HD, has something else. It's kind of, we're going through the same thing. She's really helpful. It was an excellent resource. They helped each other a lot through these tough times. And your healthcare provider may be very helpful to you. May not all know everything about Huntington's, but they'll know if you need help taking care of yourself. And I know you hear that a lot, but it's important that you keep yourself healthy so that you can do the things we've talked about. Okay, very quickly, I'm just putting up some resources. I've already mentioned the first two. The last four are just the publications that came out of the research that we did, and the Huntington's Disease Society has this information if you'd like to know where these publications are or how to access them. And so we have a little time left, 10 minutes or so. So now I'm going to turn it back over to Jane so that we can start having the conversation about the topics that I've just talked about.
Thank you so much, Janet. And as a reminder to everybody who's listening, to ask a question, you want to type it in the questions and go ahead and hit send. And while we wait for questions, one thing that I want to say is that if anyone who's listening to this presentation doesn't yet have the publication, you should definitely order a copy for yourself. And we have our first question, so let me send it to Janet.
Okay, I'm unable to, the little box I have is very small.
Okay, what you want to do is you want to right-click on the thing that is next to the X and undock it from the panel and then make it bigger.
Okay, that is not what I want to do. I'm clicking on the question.
So you want to click on and you want to drag it away from the pane, and then you go to the corner and you make it larger.
So you can easily see that I am not tech savvy here. So I can scroll it. I can see it one line at a time. I'm going to try for that. Try that. Okay. Okay, but I'm seeing one question is for those who have had the test and it's positive, what are coping strategies? I don't recall any direct information from kids who've had the test and are positive. I would suggest that going back to the conversation, one of the strategies is to ask them what's working best for you, and then talk with them about things that would be constructive coping strategies. It might be constructive for them if they're to avoid things that are not healthy. You would avoid isolating themselves. You'd want to make sure they have the appropriate emotional support. They have the opportunity to make plans, to engage in things that they enjoy, and look forward to times when they are healthy. But those are kind of general comments that I'm making. I actually can't give you anything specific about individuals. Okay, I'm going to go on to the next one. I'll just pause, and Jane may have something to add there. How would you talk to kids? Okay. This question is, how would you talk to kids about the possibility of a juvenile Huntington disease? I think the questioner may be asking about them, the possibility. I'm not sure if I fully understand the question. I would think about the age of the child. I would explain at the age appropriate level what the condition is, and that if it's a possibility, I would explain what I meant by possibility. Again, focusing on it doesn't mean that it for sure will happen or for sure won't happen. And I would also think about what's going on at that time. What's the point you want to make with the child? You want to help the child understand that there are ways to find out when the time is right. There are ways to manage the problems if and when problems come up. So I would put it in the context of what. So what are we going to do about this? How will that information be helpful to us? Okay. Resources for professionals working with the kids. I'd go back to these two resources from the Huntington's Disease Society. I would encourage you to look at the reports that we put out, because these came from the focus groups with kids and from the survey with the teens and the young adults. There's a lot more information, obviously, in those. It's written for a professional audience. It's all those first ones are qualitative research, so there's a lot of quotes and a lot of conversation in the papers about what this means, and I think that might give you some ideas and some help. I'm not comfortable with some of the friends my child wants to tell. How do I handle that? That's an excellent question. I want to know why. I want to talk with my child about why they want to tell, who they want to tell, what do they think will happen. Will there be something, they think something better will happen if they tell. Try to help my child understand why some information is private. Perhaps put off telling until a time that's better for the child. Depends on the age of the child. If something's going on in the child's life where they think it'll ease some problem they're having, when in fact it actually may not. How do you, parents who disagree on what is the right time to talk with their kids about HD? That's a tough one. So I'm not entirely objective about this, because obviously I believe that children having facts allows children to be healthier if it's done in a way that is protecting the child's, protecting the child from harm as much as possible. I would try to understand what the other parent's point of view is, try to provide them with information if you think that will be helpful to them, make them aware of other resources. I don't know if the other parent participates in support groups or has contact with others who've had similar feelings and similar beliefs. So I guess keeping that conversation going with the other parent is important to try and understand where they're coming from. Sometimes others, if this is a workable solution, counselors can help you talk together about how to negotiate coming to some common agreement on what's helpful. I would consider any of those. Okay, a question is here about caring for okay, we have an adult and caring for her dad, and she is at risk, and she has children who are in school age. Want to talk with them about what they're doing for dad, and that's a very good idea. Not sure about talking about being at risk. I would ask the children what they've learned about HD and what they've learned from the family and other places. So I'd want to understand what they know, and then I'd ask them, what do you think happens with HD, to get a sense of what thoughts they've already had. When you introduce the idea of the inheritance of HD is a hard one, but I would certainly do it before they learn about HD in school, because the inheritance pattern is one of the reasons that it's put into biology textbooks. If you know enough about your school curriculum where you can figure that out, that could give you kind of a benchmark that you want to do it before that time. Otherwise, if you can't find out that information, depending on your child, I don't think I think the ages that your children are would probably be about the time this could be brought up in a fairly factual way, not a scary way. It's something that people think about and something that will be dealt with as they get older, reassuring them that they're safe now and secure in the family, and that you'll be with them to help figure out if and when they want to know. That was kind of a long answer. Okay, I think I've come to the end of the questions that I have on my screen, so I'm just going to turn it back to Jane.
Thank you, and thank you for your detailed answers. We do have a few more minutes if anybody has any other questions, and in the meantime, I know that I speak on behalf of so many of us here and who are listening to thank you for your time and expertise.
It's my pleasure.
So it looks like there are no other questions that are coming in. If anyone has any questions or thinks of any questions, you can feel free to email me at jkogan@hdsa.org, and I will get the questions to Janet. So thank you everybody for joining us, and I hope to see you next month.